Well, if we look at the health sector from a macroeconomic perspective, then of course it's also a very important sector for employment, because in Switzerland it's actually the largest employer nowadays. So most people in Switzerland work actually in the health sector. So the fact that we still have more or less full employment is also thanks to health sector, education, and other sectors that have created a lot of jobs. While if we look at the industrial sectors, their jobs are actually disappearing, and they will disappear even more in the future due to the digital transformation. So therefore, the health sector is a very important part nowadays of the economy from a macroeconomic perspective. And then, of course, if we look from a more microeconomic perspective or so, then it's actually more about the incentives in the health system and how do we design a sound system that also has the right incentives, that at the same time that also is more or less cost efficient. So that's a totally different issue there, and somehow, however, they work together, because as long as the health system is growing also in the economy, there's a lot of money to be made. So it's the only growth market, or it's the surest growth market that we actually have. Nowhere else we can be as sure as in the health system that we will have growth in the system. And that also triggers a lot of economic interest in this system, because a lot of people try to participate in this growing market, and that also affects the whole health system.